Broadcasting from occupied territories or the flea media, it's the Reality Dysfunction podcast. A space where a diverse group of brown folk from across the nation explore the political experiences and social future of our Chicano Latino community. Control the narrative. Resist the dysfunction.
Okay, welcome to the Reality Dysfunction. Today we're going to talk about the coronavirus and the vaccine and how you can get vaccinated. So starting off, I am Javier Sanchez. We are here in Redlands, California in the Inland Empire, and it's bright and sunny, but it's cold because it's 60 degrees. Okay, and Francisco.
Francisco Lopez, also here in the 951, California's Inland Empire. Alex.
Oh yeah, go ahead.
Alex Losada coming from the East Coast.
Danny.
Dan Sosa in Saginaw, Michigan.
Reiner.
Reiner Delgado in Lansing, Michigan, where it's 41 degrees, and Sunday and Monday it'll be around 0.
Cold. Juan Carlos.
Juan Carlos Vega, Boricua in Washington, D.C., and it is cold in here.
Carlos.
Carlos Hernandez coming from San Antonio, Texas, and actually, hate to tell you, but the weather's pretty nice out here. It's like hovers around 70 right now. 70 something.
Nice. And last but not least, Ernesto.
Hey, this is Ernesto Morales coming from Prescott, Arizona, where it is almost always nice. The weather is beautiful. It's one of the only things that I can say to recommend this city to the rest of you. It has good weather.
Okay, and today we are here with my wonderful father, Dr. Javier Sanchez. Dr. Javier Sanchez is an associate professor of family medicine at UCR. He's the vice president of the San Bernardino County Medical Society, the vice chair of District 2 of the California Medical Association, and in his free time is a family practice doctor for our local Kaiser over here. And when he's not doing that, he's raising 2 awesome daughters. So.
Well, thank you so much for having me. This is a great opportunity to really get to interact with you, and it's really a privilege to get to know each and every one of you. I met 1 or 2 of you before, but this is a great opportunity. I think in the last sort of year, I've been asked to talk about COVID and the coronavirus and so on, and especially with in the communities of color. Okay, so what I'd like us to do more than anything else is really have a conversation, because I think that's the most important thing. I didn't want to have any prepared slides and so on, because I think the best thing for us is to really just have a conversation about what COVID-19 is, how it's impacted especially the Latinx community. And now that we have the vaccine available, we can actually figure out a way to get back to whatever normal that's going to be for all of us. So let me tell you a little bit about my experience with COVID. I actually got COVID right from the beginning at the end of March. As we were sort of getting ready to start to really fight this, somehow our clinic had an outbreak, and we had a couple of patients that came in and got four of us infected. And I actually ended up getting the worst of it. Ended up developing pneumonia. I needed oxygen. I needed to really spend a day in the hospital and then spend 3 weeks out sort of isolating myself. And with that, I actually got my wife infected. And then so we actually had to move out of the house to really keep our young in-laws who are 80 and 78 years old, really protected. So that was quite the experience. And when I got back into the clinic and started seeing patients, one of the first things I did is I learned about a family, patients of mine that had been pretty much with me for about 10 years. The father got really sick from COVID, ended up having to go to multiple emergency rooms and hospital stations before he was being treated. And unfortunately, he ended up passing away. And because there was 8 family members in his household all of them got infected, and his wife ended up getting really sick. So it really took about 3 months for the wife to recover. And so that to me really started COVID, and really drove the point of how important it was to really focus on educating our community and really letting everybody know how severe this disease really is. And since then, I've been sort of meeting with my family, letting them know how they can take care of themselves with COVID. I've had a couple of Facebook meetings with them. Community and the community leaders have asked me to do the same thing. So I've been doing that and obviously treating a lot of my patients, especially my large Latino population that we have. So especially in the Latinx communities, we've been impacted quite a bit. Here in California, we make up about 39% of the population, but yet we make up about 50% of the COVID cases. And about half of the COVID deaths here in California are Latinos. So it's been really a bad impact. And so why is that? I mean, we're trying to figure out why is that happening. And a lot of it is our families, our culture, what we do. We have big, large families. We have multi-generational homes, and in our family alone, we have our in-laws here. My wife and I and our kids are all here. We have a lot of families like that. They have multi-generational homes. So that if somebody gets infected, then they can pass it on to the rest of the family. Just like I got infected and I gave it to my wife, and that's why we had to leave. The other thing is we like to work, and we are pretty much the essential workers in this economy, and we all have to go to work. We can't really take time off. A lot of our essential workers can stay home and do Zoom. Okay, they actually need to go to work to really feed us, to pick our fruits, to clean our homes, our hotels, and do all the essential work that they need to do. And so it's where the impact has been. And that's why we've seen a lot of our community really impacted negatively. Mr. Arellano, one of the best writers that we have here for the LA Times, just wrote a nice article on the Atlantic about how that has impacted, how the COVID vaccine has impacted the Latinos, especially in his area over in Orange County, and how some of the measures that the community has taken, the county and so on, have been really not very useful to the community, and that really haven't helped the community, and it's actually made it worse for them. One of my mentors, Dr. David Hayes Bautista, is coming out with a book, and I think the name of the book is going to be COVID-19 Punishes Latinos for Hard Work and Strong Families. It's going to really tell us, and through the research he's done, how negatively COVID-19 has impacted all of us. And so that's been a big, big problem. So now I've joined with a group of young physicians, and they're using this hashtag, This Is Our Shot, to really educate the community about the vaccine, about how important it is to get the vaccine. The one good thing that I've noticed is a lot of Latinos, a lot of Latinx communities, they're not really into the conspiracy theories as much. Some of them are, but not as much as other communities. So that's actually been good. But some of the basic questions that I've been asked about the COVID vaccine is, why did we get it out so quickly? Is there an issue with that? How can we turn around and be able to get a vaccine pretty much in 8-9 months, where before we told everybody that it would take years and years and years to do it? And the reality is that the technology that we've been using for vaccines has been around for a long, long time, especially these two new vaccines, the Moderna and the Pfizer vaccine. These types of vaccines have been in research for over 10 years. When Ebola back in 10 years ago came out here in the US, and it's impacted us a little bit, the technology started really moving forward on how to develop these vaccines that have this protein called the messenger RNA. And so we've known that we can do this for a long, long time. We just didn't have the funding. And what changed this year from before was that the federal government threw all this money at these companies and said, don't worry about the production, don't worry about what you need to do to produce a vaccine. We will make sure that you get paid to produce a vaccine, whether your vaccine works or not. And that's where all these companies both here in the US and in Europe, went in sort of full board to try to develop these vaccines as quickly as we could, because we were able to do the research at the same time that the vaccines were being developed, okay? So they were being manufactured. But you well know that this vaccine, from the beginning, our federal government has been a complete disaster on getting the word out of how bad the vaccine is, the rollout of the vaccine, and now we're paying for it, okay? And we've seen how devastating it's been, especially to our community, all this misinformation that's been going on. So now our opportunity is to make sure that we get everyone vaccinated, because this is what we want, is we want to get back to normal. And that's why there's all these young physicians using that hashtag, this is our shot. So this is our shot to get back to normal. This is our shot to be able to get back to our parties with our families, to be able to go to the quinceañeras, the posadas, you know, the large gatherings, the birthday parties. I mean, in our family, we have missed that tremendously. I think I've never spent so much time with Francisco as I did this last 8 months, because that's the only family that we see. I don't see my extended family. I see them on Zoom, but physically, you know, it's between when we go to Moreno Valley to visit with them, that's our night out. That's where we get our air. And so what we want is make sure that everybody can get out there and get back to whatever that normal, and we want to get them to get the vaccine. Now, in terms of the vaccine, myself, I got the vaccine as soon as I could get it, despite having COVID, okay? And the reality is that everyone, for the most part, who gets the vaccine, you will get some side effects. Some of us will get the side effects that are going to be mild. Some of us are going to get the side effects that are a little bit harsher. I've been very, I guess, lucky that I had a pretty bad reaction the first time I had the vaccine. My wife wasn't as bad. The second vaccine wasn't as bad. But I think we need to be upfront with everyone to make sure that they understand that you may develop some side effects, and those side effects are not going to be as bad as getting the coronavirus, but you need to be ready for it. So that way, when they get the vaccine, there's no surprises for them. And with that, I'll leave it up to you guys to ask me any questions. Again, I want this to be more of a conversation than anything else. Be happy to answer anything. We can go anywhere you want.
So Javier, I wanted to follow up with you on the hashtag, this is our shot. What are some of the avenues that this group is spreading the message through? Where can
this has been a tremendous, I mean, I've been incredibly impressed. It started out with, so at the California Medical Association, we have different sort of groups. And one of those groups is the Young Physician Group. And these are young physicians who have been in practice less than 5 years. And they're incredibly savvy with social media, okay? And so what they did is they said, we got to get people not only for them to learn about the vaccine, but we also need to encourage them. So they've been posting on Facebook, on Twitter, on Instagram, every time they get a shot, anybody who gets a shot, that this is our shot. Any kind of information that they have, they want to press it out. So it started out with a group of 50 young folks, and I was included in it because of
You're a young folk.
because of being talking to the Latinx community, and because they wanted to reach not only the general population, but also the African American community and the Latinx community. And so they've been doing that. But with that, they've actually partnered. They started out with partnering just with the California Medical Association. Now they partnered with the American Pediatric Association, the American Academy of Family Physicians. They partnered with the National Hispanic Medical Association. They have, I mean, now it's US wide. I mean, they have over 150 organizations they have partnered with. And every Tuesday they meet to continue to increase this number of doctors that are getting involved in it, to educate the population about the importance of getting the vaccine, but also they're letting us know, they're giving us information about how to work with social media, what to do. Last night we had a fantastic meeting about projecting a positive message about the vaccine, about making sure that you don't get caught up with the anti-vaxxers, because that could be a rabbit hole you don't want to go into, you know, and so they really are doing fantastic. So if you go on Facebook and you put this is, you know, the hashtag this is our shot, or you go on Twitter or Instagram, you will see that. And then they're providing significant information about the side effects, about the types of vaccines, about where the rollouts in the particular areas, whether in California or Colorado or Washington or whatever it is. You know, in Detroit, we had a talk about somebody from Detroit last night. So they really are done a fantastic job in the last 30 days to expand their message about the importance of getting the vaccine.
So if somebody wanted additional information, they could just look up, this is our shot, COVID-19?
Yes,
Okay.
yes. So, and also it can provide you the resources where you can go.
Yeah, that'd be great. We'll put them on our webpage.
So I have a couple of things. One, I just want to say that I really appreciate you being here. I think it's super important. I got my shot a month ago, my first shot, and I go for my second shot February 6th, which is this Saturday. And I just want to say for the record that I do that with no fear. And I got my first shot with no fear. You know, I've been vaccinated against different things my entire life. I mean, I think I'm one of the last generations that has a polio vaccine mark. And I'm just, I don't know. I don't know how to categorize the whole anti-vaccine thing. I think it's very strange. But I wanted to ask you a question, and it's not necessarily about the vaccine, but it has more to do with the vitamin D and like the melanin. And I was just wondering if maybe you could talk about that a little bit, like what your opinion is about that. Yeah.
Yeah. Okay. So wait, I'll go first because this is actually like a really interesting thing that happened to us. So I have very severe asthma. I take like a high dose of an allergy medicine, almost an equivalent to an allergy shot because of my asthma. And one of the things that my allergist had recommended was taking high doses of vitamin D. And so I have been for, you know, more or less 2 years now. And, you know, that was one of the things that, you know, post my parents getting sick was one of the things that we were like, oh, that's probably one of the reasons why I didn't get sick, because I was around them. We didn't know at the time that we needed to wear masks, you know, and we were just washing our hands and doing all that kind of stuff. But I was, you know, still within the vicinity of them while they had coronavirus. But I was taking these high doses of vitamin D and I didn't get sick at all, which is phenomenal considering the fact that we live maybe like 5 feet away from each other. And so, you know, that was really crazy, but yeah, that's our experience.
So one thing that I always tell my medical students and my residents, what I learned in medicine back as a medical student, as a resident, 50% of what I learned is wrong, okay? What I don't know is what that 50% is. And that's the beauty about medicine is we keep evolving, we keep learning things. You know, when we first learned about the coronavirus, COVID-19, we really didn't know much about it. Now we know a lot more, but it keeps evolving. So a lot of the information that we were given early on, it may be irrelevant now as compared to now. So, but one of the things that we've learned is actually vitamin D really does help. So for whatever reason, and we still don't know the mechanics behind it, is why does vitamin D is protective against the coronavirus? But we do know that those individuals that have high levels of vitamin D tend to do a lot better. They don't tend to get infected as much. And those that have the lower levels tend to get infected more frequently and they tend to do worse. And so right now we started saying, okay, everybody should be on 1,000 units of vitamin D. Now we went up to 2,000. And the latest ones is between 5,000 and 10,000 units of vitamin D daily. So, you know, it's evolving and we are seeing that. So the other sort of supplement that we know that works, and again, we don't know, is zinc, okay? Now, zinc doesn't work as protective as vitamin D, but zinc has some protective factors there. But we do know that 40 milligrams of zinc is probably enough for most people, okay? But it's not as severe as what we've seen with vitamin D.
Yeah, and one of the things that we're going to be looking at, because I'm the last one to not have the vaccine, but I should be getting it soon, hopefully, is how my high levels of vitamin D are going to affect my side effects of the vaccine and of the shot. If they're going to be less, if they're going to be more, what's like, me compared to the normal. So.
Doc, can I eat the vitamin D somehow instead of a supplement?
I'm sorry, say that again. The vitamin C.
Can I eat the vitamin D and the zinc somehow instead of taking a supplement? Supplements are pretty expensive.
Right.
And they're not covered by insurance.
No, they're not.
So, I mean, it's incredible how expensive they are, and they're supposed to be for our health. So, can I eat it somehow? Is there something I can eat?
Milk?
Get out in the sun.
Bok choy.
I don't know. I'm asking the doc. Doc, what do you think?
So the quick answer to that is yes. But the long answer to that is you probably cannot eat enough to get the levels of vitamin D that you need if you already start with the low levels, okay? And so that's an issue. Now, but the majority of the vitamin D that we get is actually from the sun, okay? And so that's the big issue. So the US, if you look at the equator where we are located from the equator, we're actually a little further up than we should be. So the amount of UV light that we get, the amount of rays that we get from the sun, that's one of the major reasons that here in the US, we don't have a lot of people, we have a lot of people with vitamin D deficiency, or at least low levels of vitamin D.
Time to move to Colombia and Puerto Rico. That's it. That's the last one.
There you go. So
I have a question. When it first started hitting, they were talking about vulnerable populations and especially people with pre-existing conditions and certain conditions that made it worse. In the beginning, because they didn't know, they kind of talked about like those were the people that were definitely the most vulnerable to mortality, But as it's gone on, it seems like, man, this can take anybody. Certainly certain populations are at risk, but it seems like it doesn't really matter. So what's the latest studies or the latest insight into why, some people just get kind of like a cold, like have some mild symptoms or the flu, and then other people, it takes them. Like, why is there such a fluctuation of results? And it doesn't seem necessarily to be age or pre-existing conditions. I mean, it seems kind of like it can do it to anybody. Is there any studies or insight into why?
So right now, the majority of the information that we have is that when you get infected with the coronavirus, is that you get an inflammatory response. Okay, so it's a diffuse inflammatory response. And the issue lies in the kind of response you get. And some people get a worse response than others. We do know that more men are more susceptible than women. We don't know why. We do know that the older population, the vulnerable populations, those populations are gonna, if they do get the virus, they may do worse. Okay, so we do know that. We still don't know why certain people don't get as bad of a reaction as others. We do know that it has to do with the inflammatory response that you get, and that's why with kids, this is something been very fascinating. Is that the immunology or the immune system of kids hasn't fully developed, and so when they get infected with COVID, the response to it is very minimal. And therefore, they don't get really sick, but they could be carriers. So they're carrying the virus, okay? Older populations, sort of 18 and up, we do know that it can vary. The more susceptible you are because your immune system is lower, the worst response you can get. It's called a cytokine crisis that can occur, okay? And so for whatever reason, some people react a lot worse. There's some theories behind it, but they're still not quite clear as to why, okay? And that's why some of the treatments that you may have heard in the beginning, people thought they were gonna work. And the most common one is hydroxychloroquine, okay? Where they made a big deal about that at the beginning because that's an anti-inflammatory medication. And since this was an inflammatory disease, they thought just load you up with that, minimize the inflammatory response, and you'll be fine. And that really doesn't work, okay? So it doesn't really work. The research clearly shows that it doesn't really work. In other countries, right now in Brazil and in Africa and in India, they're using an anti-parasite medication, ivermectin, for the treatment of it, especially at the early signs of it. We don't know if it's going to work or not. We don't really know why it might work, okay? In the US, we're not using it, or most people in the US are not using it. I can't say that we don't use it. Again, there's still a lot to learn, okay? And I will probably know more in the next 5 years about the impact of the coronavirus on the body. We do know it's an inflammatory disease. So it causes significant inflammation. And that's why you see some people with significant inflammation in the lungs. They can get blood clots, they can get bleeding in the brain, okay? And that creates a big problem for them.
Okay, Reiner, next question.
Oh, okay. I was just trying to get some clarification. UCR, that's the University of California, Riverside?
Oh, yes.
Okay. And yeah, it's interesting to hear about the vitamin D and the zinc, because by coincidence, my endocrinologist tested me and he's like, well, I want you to start, this is September-ish, and he's like, I want you to start taking a vitamin D supplement, B12 supplement. And then at the eye doctor, the retinologist, he was like, here, to have these free samples, and they coincidentally had zinc in them. So I was just like, hearing that, I was like, oh, that's some beneficial happenstance for me, but good to hear. So I find this very interesting. So if anyone else has some stuff to hear, I'll go fight with anti-vaxxers online, but I do that anyway. So
I have two questions,
Yeah.
if it's okay. Thank you. Thank you again, Dr. Sanchez, for coming on the show. I think this will help a lot of people. My family I lost my first cousin a couple of weeks ago to the disease, and he was a single father when he passed away. So I hope somebody hears this and does the right thing, I guess is the best way to say it. But I have two questions. I saw a statistic, it's been going around the last couple of weeks, that 62% of workers in nursing homes have refused the vaccine.
Oh, yeah.
This has been confirmed by a couple of different sources, which is really shocking to me. I think 25% would be shocking to me, but it seems really odd that the majority of these people, and they work in healthcare, are refusing the vaccine, and they're around people who are very susceptible to the disease. Do you have an opinion on that?
Well, it's very, very unfortunate. And I wish I could tell you that the data is incorrect, but it's not, okay? Last night I was looking at some data, and just here locally in Southern California, only 39% of healthcare workers in nursing homes had been vaccinated, okay? Even though the vaccine has been available for them since the beginning. I don't really know sort of some of the hesitation. I think we're trying to learn more about it. A lot of it is education. A lot of it is that they don't think it's going to be bad for them. They don't know enough about the process of how the vaccines came about. Okay, I know there's some information out there that there's a chip on the vaccines, which is ridiculous, but people believe it. And so what our goal is to really try to focus on them, and try to focus on asking them why is it that they're hesitant about it, okay? Meet them where they're at, and then try to encourage them to get vaccinated. And I can tell you that once we get a one-on-one with these individuals and we hear their hesitation, more often than not, they're turning around and getting the vaccine. But we have a lot of work to do.
Thank you. The second part of my question is, there seems to be a lot of confusion, misinformation when it comes to the availability of the vaccine, depending on your individual characteristics, right? I mean, it seems like 65 and older in every state in the country can get the vaccine now. And if you got pre-existing conditions, but I'll use myself as an example. I have diabetes, and my employer also certifies me as a child welfare worker, right? So I have a letter from my employer saying I can get the vaccine. I went to the health department website yesterday and I couldn't figure out how to sign up for a vaccine. Okay, I mean, I don't consider myself a stupid person. Maybe Todd does, but I don't know. I'm just kidding. But yeah,
Consider
I couldn't
you
figure
or
it out.
myself?
No, consider me. But the two categories on their website were 65 and older, and then there was a section for group vaccinations. And I'm clicking on things, I'm reading, and I couldn't find it. So I've kind of made it my mission today to figure out how I can get a vaccine, because I'm also part of a group trying to spread correct information, and I've committed to take a video of myself getting the vaccine and that sort of thing. But so my question is, it seems like we're all over the place depending on what state we're in. What are some states, in your opinion, doing right, and what are some states doing wrong?
Well, first and foremost, you have to understand the distribution of the vaccine. So the federal government is responsible for the vaccine, and the federal government dictates which states get the vaccine, when, and how much of the vaccine they get. Once they get to the state level, then the states then pretty much decide where they want to do it. And some states, they've been able to work directly with certain groups. Others, like here in California, at the beginning, they said that it was going to go through the public health departments of each county, and that has been a complete disaster. Okay, it hasn't really worked out that well. And so it's just primarily a lot of the hesitation from some of the states about giving the vaccine or making it available is that they want to make sure that there's enough vaccine available, so not only you can get one, but you can get the second one. Because right now, here in the US, we only have Moderna and Pfizer available. And so that's been a big issue. The second thing is that just the rollout itself, I mean, because of that, it's been a complete disaster. I mean, it hasn't been well organized. In some areas, they've done it quite well. I'll take, for example, I think it was Idaho. Idaho, despite being a very small state, they decided to just give it up. They could give it to everyone, especially essential workers and teachers and so on, because they wanted to open up the schools. So what they did is they said, okay, we're going to open up the schools, but every teacher is going to get the vaccine, and we're going to go to your school and give you the vaccine. Now, obviously, it's a small state, so that way they can get it done much faster than the bigger states like Texas and California and so on. But the one thing is that the federal government now, in the last 2 weeks, they really have figured out that, okay, we don't have enough vaccine. We were told that they kept a reserve by the previous administration of 100 million doses. It turns out that was never there.
Oh, no.
And so a lot of states were waiting for that. Okay, we're going to run out and we're going to get it. It was never, they never had a reserve. I mean, they never did. And so this new administration has been working with the companies to really get the vaccine out. And now they purchased a lot more. And now Moderna just this past week said that they were going to increase the number of doses in each vial, and then we're going to start to giving those out. So it's really been a complete disaster, just like it's been from the beginning about how to deal with this pandemic. But we're learning, okay? And now you can get the vaccine at local pharmacies like CVS, Walgreens, and so on. So you can go there. You talked about going online. I mean, just in my institution at Casa Permanente, we thought we want everybody to get on the app. We want everybody to make an appointment, to get the vaccine. We'll send you a text. Okay, and we're going to do it to the 75-year-olds and older. Guess what? These folks, even though they have the app, they have no clue how to go. And it takes 5-10 minutes to click in this and this and that to make sure you're eligible for it. And, the first 2 weeks of the rollout to the 75-year-olds, we only got about 20% of them.
Yeah.
Okay. And then people were showing up to our clinics and saying, I signed up, and they hadn't signed up, and nobody was helping them to try to get the appointment. So, I wish I could tell you that it's going to get a lot better soon, but it will get a lot better quickly, much faster than in the past. And if you fall within those categories right now, if you're 65 and older, if you have pre-existing conditions, if you're a teacher right now, I think teachers are on the line, you can find the vaccine. Either go through your health department, your public health department, go through Walgreens or any of the pharmacies they have it, and you should be able to get the vaccine. And also remember, the vaccine is free. So no matter where you get it, you don't have to pay for it.
So I just had a couple of questions in regards to, are there any populations that should not be taking the vaccine, that they need to be aware of any severe side effects, or it's not going to work well with whatever conditions, pre-existing conditions they may have?
So the only group that should not get the vaccine is those individuals that have had significant anaphylactic reaction to the flu vaccine. And that's a very small amount, okay? Even though there's a chance that even if you haven't had that kind of a reaction in the past with the flu vaccine, that you can still get it with this one, but that's right now the only group.
Okay.
In the studies, they didn't include any kids. So 16 and under right now is not something that we're making the vaccine available. There was very few pregnant women with the Moderna trial, but we're seeing that it's relatively safe for them, okay? The same thing that we're breastfeeding for women who are breastfeeding. We also, there weren't really any inclusion in that in the study, but now we're noticing that there's really no contraindication. Now, it's something that if you're pregnant, if you're breastfeeding, you should have a conversation with your primary care doctor and look at the risk-benefit ratio for you. But what we've seen now that we're not really seeing any problems. Now, at this point, as of last night, we've had over 24 million people vaccinated, okay? So by that time, we should know if there's any significant issues with the vaccine, and we don't. And I mean, we really haven't seen anything other than some of us get really bad side effects that we're down for a couple of days, but other than that, we really haven't seen anything.
My parents have gotten the vaccine. My parents are in their mid-70s, right? Yes. And so they're actually a part of Kaiser. And it was my sister who had to help them get their appointments because, they're trying to figure out from the app, like, well, I can't see that looks blurry. So we were very thankful. They actually went, I think, to Dodger Stadium is where they went because there was nothing close by. So we were very thankful. So now they've gotten the vaccine. So what are some precautions that they still need to be taking into account, even though they've had the vaccine? Right now, it's just like, oh, well, we're going to come and visit you, or we can go out with no masks.
Right. So after you get the first vaccine, your immune system response is about 50% protection, okay? After the second shot, That's where it goes up to 94% for Moderna, 95% for Pfizer. So that's phenomenal. Okay. You also have to remember that there's still a chance you can get it. I mean, there's still a 5% chance, 6% chance you can still get it. But we do know that, especially with the studies, that even those individuals that got the vaccine who got sick, none of them were hospitalized, none of them died. Okay, so that's phenomenal. So that means that not only it protects you significantly against getting the vaccine, but even if you do get it, you don't get any severe complications from getting it. Okay, now the big question is, where can we stop using our mask? When can we stop? When can we start gathering with individuals, with our families and so on? Well, for that, it's a little bit more complicated because we need to make sure that the population as a whole gets vaccinated or has had the coronavirus at one point or another. And we need about 70% minimum of the population to get to that level. We ideally like to get to up to 80% of that, okay? So right now, based on the number of people who have gotten the vaccine and based on the number of people that have been infected with the virus, we know probably there's probably about 100 million people right now who have some kind of immunity, okay? So based on the data that we have, we think there's about 100 million people right now who have either been vaccinated already or have been infected with COVID and they have some immune response to it. So we still need to get, if there's 350 million people in the US, we still have a long ways to go.
Yeah, so long story short, still wash your hands, wear a mask, double mask if you can. Okay, Juan Carlos.
Yeah, appreciate that, Doc. All your really honest, doctor answers, right? And so for since like 2001, I've been working with CDC funded projects relating to the reduction of health disparities. And one of the projects in which I worked on was the National Influenza Vaccination Disparities Project. And we specifically were targeting creating strategic, outreach strategic communications in Spanish, in English, that were for our gente, for our familia, right? And, while I'm truly surprised how the departments of health at the local level have not been ready to distribute, even if they were not, and even if Trump messed up not having the vaccinations ready, fine. But why aren't the departments of health at the state and city county level ready when they do this already with the flu vaccination, and they've been doing it for so long? So I am in total shock that they're not, prepared for that. And that's not my main concern. My main concern right now is that the Vaccination Disparities Partnership exists because there's no effective outreach to our communities. There isn't, and I know, and that the general CDC content, which is the main public health agency in the country, does its minimum that gets to our communities, and there's still some section in Spanish instead of being fully integrated. I am concerned about the people of color, the migrant, the undocumented, the trans, the Spanish speakers, the recent arrivals into the system, and even the uninsured who don't know that can get it for free, right? As a doctor, what is your recommendation? And you're a professor, and you are Carolina's father, and you're a lot of things, right? But as a doctor that works, on the ground, what is the best way that the public health system needs to, what do they need to do to get access to the vaccine to these communities that otherwise may not go to the Walgreens or may not go to the county health hospital? Sorry about the long question. Thank you.
No, I mean, unfortunately, most of our public health departments and public health in general has been underfunded for decades, okay? So we really haven't put a whole lot of money in public health for almost 2 decades. And that we're seeing the consequences of that. The second thing is just knowing about our community, the Latinx community, our African-American communities, and getting the message to them. And one of the things that I've learned in the last 20 some years that I've been a physician is that we need to go where they are. We can't expect them to come to us, okay? And that's the approach that we've had for a number of years, is we think, okay, we're gonna make it easy for you to come to us. And they don't come to us. I mean, that's not it. So we have to go to them, okay? And as folks like me and others, they're pushing our institutions, okay? Whether it's Kaiser Permanente or University of California, Riverside Medical School, the county facilities and our politicians and everybody to really go to where the community is, okay? And that's what we're learning. And we're doing it more and more. I'm not saying that we're perfect, but we're doing it more and more. And this is one example that I think we're learning about, is that how do we get our communities vaccinated, okay? And it's not about making it just the vaccine available, is we need to go to where they're at. Ask them, what is it that you need in order for me to give you the vaccine? How do I make it easy for you to get the vaccine? Okay, what's your hesitation, if any? Okay, and surprisingly, what I've seen in our community, there's very little hesitation. They want the vaccine. They want to get back to normal, but they don't have the access to it.
But that means providing access after 5 p.m. It's in the evenings, it's in the weekends, it's just the hours where the sex worker is. That's where we need to go, because the sex worker is not going to go to Walgreens or CVS. Thanks, Doc.
I think one of the other things too that I've noticed with how like my dad and my mom have approached this subject is doing a lot of stuff in Spanish and in English, having these translations. I know early on, Riverside County was doing dual like press conferences in both Spanish and English, because that is, the majority of their community. And I think that's really important. And the other thing is also making yourself available. Like my dad has made himself available to talk, to be able to text with our family friends, all these kind of things about our own hesitations. And so as someone who is like, the daughter of a doctor and can see this, I would recommend, if like any Latinx doctors, but also like any doctors of color, like reaching out to your community and either having like open office hours or any of that kind of things to just make yourself available and have that access, right? Because first and foremost, you need education on what it is. And if you can have education in a language other than English so people can more easily understand it, I think that's going to be super, super helpful for the first like step to do it.
Okay, thanks. Do we have any information, or what's the best, educated research or on, once you've received the vaccination, how long are you protected?
So both of the studies that we have right now, both the Moderna model, or the Moderna study, as well as the Pfizer one that's been published and available for everybody, the immunity of it, the protection, it's going to be dependent on a number of factors. Okay, one is going to be on the mutation of the virus, and we've already seen some mutations that have occurred, and you may hear in the news about the Brazil mutation. You may hear about the South African mutation, the British mutation, and what the especially Pfizer and Moderna, because we have more of the information with them because they're more available, is that they are working on making sure that the vaccine is working for those mutations, number one. And number two, if it doesn't, can they develop something quickly to protect them, okay? So right now, we think that the vaccine itself, the amount of immunity that you get that can go up to 95%, is that it probably will last a year to 2 years, okay? Maybe even more, or, right now that's the thought. So with the mutations, We do know that with the British one, which is the one that we think is going to become the more prevalent in the next few months, that these 2 vaccines work quite well for it, okay? So it's not really a big problem. With the mutation that we've seen from South Africa and the one from England, not England, from Brazil, it's still going to work probably about more like 80%, 84%.
Okay, and then Nino.
Very good. So what about reopening? We're talking about the vaccine, and that's definitely taking us closer to reopening. Many of us here are, in one way or another connected to education. How do you see that going about? And I think today I was reading an article saying that what we're finding out is a lot of the spreading is being done by actually adults, 25 to about 50 years old. So is opening up the schools, getting back to this normalcy, how do you see that being possible? What's your outlook on it?
Right. So ideally, what we want is to really sort of get back to normal is in sort of reopening everything, is we really need to make sure that at least 70% of the population has some form of immunity, whether they had the virus or they've been vaccinated. So that's the ideal thing. Okay. The economic and the political thing it's different. Okay. Because it's going to be based on what the politicians and the public wants. And therefore, what we need to do is we need to make sure that we continue to practice some of the things that we've been preaching for the last 8 months or 9 months, is that one, we need to continue to use face masks if we're going to open. We need to continue to practice physical distance as much as we can. And we need to try to limit large gatherings, okay? Now those gatherings maybe we can expand it to 30 people, 40 people, little by little, depending on who gets vaccinated, who has immunity or not. And so that's going to be, again, it's going to be more a political situation than anything else. But medically, to sort of feel like we have a control over the virus, is we need to have at least 70% of the population with some form of immunity, either vaccinated or have had the virus. And we're still a long ways from there. So I think for large gatherings, especially states like California, New York, more progressive states, they're probably going to hold off on large gatherings a lot longer than states like Florida, Texas, and that's just going to be the political reality of that.
Okay, and then I have one question, and I think it's one that you've been asked a lot, is that if you have COVID and you're eligible for the vaccine, should you get it?
Yes. So everybody should get the vaccine. Okay. So the only group right now that we're not providing the vaccine is if you're under 16 years old. And that's going to change in the next couple of months. I think we're going to allow some kids to get it because we're not really seeing any problems with that. So if you need to get, if you're over 16, you should get the vaccine if that's available for you, and you should get it as soon as you can. Okay.
And then when, after you've had COVID, should you get a vaccine? Because we're in short supply, all that kind of stuff.
Right. So the Centers for Disease Control recommends that right now, if you have had COVID, you want to wait until you have between 10 to 14 days, so you finish your quarantine and you have no symptoms for you to get the vaccine. At the beginning of it, we were a little more cautious. We're telling people to wait 3 months before they get the vaccine. Now it's changing. So we're now making it available for anybody. As long as you have finished the quarantine and you have no symptoms, you can go ahead and get the vaccine.
Cool. Okay. So I want to thank you for coming. This is very informational and it was fun to have you here. Don't forget to check out This Is Our Shot for more information on vaccine distribution and COVID information in your area. This has been the Reality Dysfunction. Wear your mask, wash your hands, and thank you all.
This is the Reality Dysfunction.